is 11/8/2022, and the informant is mother, reliable.
Okay.
Presenting complaints, decreased activity and feeding since 2 weeks. History of presenting complaints. Child was apparently normal till 2 weeks back. Then mother noticed decreased activity and feeding.
Can I interfere?
Yes, ma'am.
Was the child apparently normal?
Child was having moderate activity till 2 weeks back.
Eh?
Child
was the child apparently normal? Child had so many problems,
yes,
isn't it? Was
yes,
not normal.
Yes, ma'am. Till 2 weeks back, then developed decreased
you
activity.
Can say the child was having problems. And the details I'll be telling in the past history and developmental history.
Yes, ma'am.
Okay.
Okay. He was noticed to have a decreased activity and turning over, which he could do previously. He was also not responding to mother's calls as before. All these were following a history of fever and cough, which required hospitalization prior to the detection of poor activity, and there was no history of any trauma or abnormal movements during this period. Since the child was having problems from the early infancy, I would like to start from the antenatal period. Antenatal history. He is the third child of P6L4A2 mother who was spontaneously conceived at 32 years of age. First trimester, pregnancy was detected at 6 weeks. Pregnancy was detected at 6 weeks by UPT and had regular ANC from Sharjah. There was no history of any fever, rash, or UTI or X-ray exposure. Folic acid and calcium tablets were taken regularly.
Can I ask you a question?
Yes, ma'am.
Folic acid, you had to specify the time when it was started.
Folic acid was started after the first antenatal visit, ma'am.
Do you think that will give any protection to the...
No, madam. Ideally, folic acid should be started before...
Then you are inviting the question here.
Okay, ma'am.
When you say that the folic acid was given, but it was not prior to the pregnancy.
Okay, madam.
Okay.
Calcium tablets were taken regularly. No history of any hyperemesis gravidarum.
Or else you can see after the pregnancy was detected, the lady was placed on folic acid and calcium tablet. Okay, ma'am.
No history of any hyperemesis gravidarum. Injection TD 2 doses were taken and dating scan was normal. And in the second trimester, quickening was felt at 5th month. No history of any bleeding PV. Iron, calcium, and folic acid tablets were taken regularly. No history of any gestational diabetes, pregnancy-induced hypertension or hypothyroidism. Anomaly scan was normal. And in the third trimester, appreciated good fetal movements. There was no bleeding or leaking PV. No gestational diabetes, pregnancy-induced hypertension or hypothyroidism. And calcium tablets were taken regularly. Late scan was normal. She had a weight gain of 8 kg during the pregnancy, which is inadequate.
Well, the gynecologist says that 8 kg at 34 weeks of gestation. I just verified it. That all depends upon the body mass index of the mother. I don't know what was the stature of the mother. Have you seen the mother?
Yes, ma'am.
Is she 50? What would be the body mass index? Is it?
She was only moderately, not too ill-built, but moderately built.
They all calculate the pregnancy gain of weight in pregnancy and compare, give the adequate privilege depending upon the body mass index of the mother. Okay. For a lady who is having the body mass index, BMI, around about some 26 or something, they won't allow the weight gain beyond 10 kg. And this is only 34 weeks of gestation. So when you commit, you should understand there is a point. When you commit that the weight gain was inadequate, you had to commit the body mass index of the mother also. Otherwise, you will end up in trouble. Okay.
Okay, ma'am.
Otherwise, you say mother was not seen. She was abroad, so I cannot give a comment.
Okay, ma'am.
This point you had to highlight here. Okay.
Okay. Natal and postnatal history. Baby was born by preterm vaginal delivery at 36 weeks from Sharjah. Baby cried soon after birth and had a birth weight of 2.05 kg, which is small for gestational age as per WHO intergrowth chart, as it lies below 10th percentile. Baby was given for breastfeeding within half hour. There was no history of any breathing difficulty, decreased activity, abnormal movements, or difficulty in feeding. There was no history of hypoglycemia as stated by mother. Passed meconium and stools within 24 hours, and baby and mother was discharged on postnatal day 2 in view of COVID pandemic.
No history of hypoglycemia. How can the mother perceive hypoglycemia?
Madam, that she was not informed about low sugar values from the hospital.
Why should they do? Did they look at the blood sugar of the baby?
Madam, since it's a small for gestation baby,
At this point you had to highlight, because in small for gestational babies, there is possibility of hypoglycemia. So in the labor room or in the nursery, they would have tested the baby's blood sugar. That may be the reason.
Okay.
Cannot say that, don't say like that, no history. Baby was tested for hypoglycemia and was normal. It was not there. Okay.
At home, baby was active and was feeding well. After around 2 months, mother got conceived again and had to resume work and was unable to give adequate care to the child. By 5 months, she noticed delay in neck holding and rolling over. Baby was also not responding back adequately when talked to, and child could, however, hold objects when placed in hands and was able to turn head to sounds. There was no difficulty in changing diapers. Mother noticed no flabbiness of the child. There was no abnormal eye movements. There was no difficulty in breastfeeding. There was no nasal regurgitation of feeds. By 6.5 months, grandmother noticed abnormal movements in the child by which he would flex upon himself. Initially, these movements occurred in clusters of 3 to 4 episodes per cluster, 1 to 2 times per day, and child remained active afterwards. Later, the frequency of such movements increased, and with the development delay and increasing frequency of such movements, child was evaluated for the same in the local hospital. MRI, EEG were done and said to be abnormal. Child was admitted in local hospital and was started on some costly iron injections. Child showed improvement and was discharged on anti-seizure medications and multivitamins. After the treatment, he could partly turn over and lift chin off the couch momentarily and had no abnormal body movements.
So did he regain the original developmental status after the injection and the medicine?
Madam, this was child was admitted at around 8 months. He could then attain only partial turnover and could only momentarily lift the chin off the couch. No age appropriate.
The same degree of developmental status the child could attain or not, or somewhat only. Couldn't follow the question.
No, madam.
See, the child had some developmental milestones before they gave this injection and medicine. After that, he partially recovered means could he go into the same original level of development or better than that?
He improved a little bit, madam.
Okay.
Come to the development history. Gross motor, he attained partial neck holding by around 8 months and attained partial turnover by 8 months. And there's a development quotient of 45% and development age of 5 months. Fine motor, bidextrous reach was attained at 8 months.
How did you come to the 5 months?
Partial turnover only, madam. 4 to 5 months.
4 to 5 months, what will happen to the neck holding of a normal baby?
By 3 months, complete neck holding.
Okay, can you expect that much of neck holding in this child?
No, madam, no.
Why?
This child already had delay and only following the injection only he recovered a little bit.
No, any other factor by which you had to give allowance?
He was born preterm and was also having a low birth weight.
Baby was born preterm, that allowance of 4 weeks you had to give, isn't it?
Yes,
okay.
And in fine motor, he had bidextrous reach by 8 months and with the development quotient of 36% and development age of 4 months. And personal social smile was not attained. Development age is newborn. In language, he could coo at 4 months. Development, no other milestones were attained. Development quotient was for 27% and development age is 4 months. Development quotient ranges from a newborn period to 5 months. All milestones are delayed, especially the personal and social development.
Okay. That is the main intellectual
Yes, ma'am.
communication.
Coming to nutritional history, maternal nutrition was defective during antenatal period and had a weight gain of 8 kg during the pregnancy. Since mother was engaged in the duties in the hospital there. Child was born IUGR with a birth weight of 2.05 kg and baby was breastfed immediately after delivery and was on exclusive breastfeed till only 1 month, as mother had to resume work. Formula feeds were introduced after
Can
1
I
month.
interfere here?
Yes, ma'am.
At the end, in the end of first month, or at least what will be the first checkup, that what is the date of first checkup the neonate to be brought to the hospital after the discharge? Ideally.
Ideally, baby and mother should be called for review after 1 week. But here we
1 week.
6 weeks immunization, madam. But for a low birth weight baby.
Before that, ideally, don't say that whatever is followed. Ideally, the baby has to be brought with, especially being the preterm baby, and there were problems which could not be completely covered by the hospital because of the COVID season. Baby should be allowed to come back after 2 weeks and see whether the catch-up growth has occurred.
Yes, madam.
So, were they given that facility or privilege in Sharjah?
No, madam.
That you have to highlight here. Okay.
Ah.
Then breastfeed still 1 month, and at the end of which, does the mother, being a nurse, does she know that the child was having this much of weight? That also is not, isn't it?
Yes, ma'am. She gave breastfeeds only during before going to work. Only she gave breast milk, and that too till only 1.5 months she gave.
How long was she having leave, maternity leave?
She had to resume the work after 1 month, madam.
Till 1 month the baby was on breastfeeds. At that time, what was the weight? Mother doesn't know, and she has not bothered to see the weight of the child. Okay. Yes, then you have to say, highlight these problems here. Right?
Okay. Formula feeds were introduced after 1 month with 1 level scoop in 30 ml, 60 to 90 ml per serving, given 2 hourly. Breastfeeding were continued till only
2 hourly means 12 feeds were given. Is it so?
Yes, ma'am.
There is a gross error in your calculation that we'll come and see in the table, and I couldn't follow that. 2 hourly, that means 90 ml.
Yes, ma'am.
90 ml 2 hourly means 12 feeds in a day.
Yes, ma'am.
We'll go to that. Continue.
Breastfeeding continued till 1.5 months. Complementary feeding started from 5.5 months with Ragi, and currently child is on formula feeds and complementary feeds. Currently, the child is given 90 ml only 2 times per day. Once the complementary.
You told me that 2 hourly the baby is being given this 90 ml.
Madam, after the complementary feeding was started, they reduced the.
You are saying the present diet.
Yes, madam.
That's why I have a heading. Present diet 90 ml 2 times daily. That's okay.
With a calorie of 120 kilocalorie and 2.8 gram, Ragi, 4 tablespoons 2 times per day with sugar to taste. Cerelac 2 teaspoons with 1 serving. Fruit juices with no added sugar.
What is the measure?
Madam,
Cerelac.
അതിനകത്തെ സ്പൂൺ ആണ് 2 സ്പൂൺ ഇട്ട് ഒരു സെർവിങ് അങ്ങനെയാണ് കൊടുത്തിരുന്നത്.
ആ സ്പൂണിന്റെ മെഷർ എത്രയാണ് അവരത്രേ പറയുന്നത്?
10 gram.
ഒരു സ്പൂൺ is 10 gram അങ്ങനെ എഴുതിയിട്ടുണ്ടോ?
മാഡം സെർലാക്കിനെ മറ്റേ സെർവിങ് സൈസിലും കാൽക്കുലേറ്റ് ചെയ്തപ്പോൾ ഇങ്ങനെയായിരുന്നു.
See, 100 grams of Cerelac will be yielding 419 calories.
Yes, madam.
Actually, did you go through that? All the commercial preparations, which are the complementary feeds, you have to just go through it at least. So, because still people are using it very much.
Yes, ma'am.
So 100 grams yields 420 calories. Then this is how much gram? If it is 20 gram, how much will be the calories here? അത് നോക്കിയായിരുന്നോ? Did you look in?
Yes, madam. Yes, madam.
And did you go through the Cerelac-tin and said?
Yes, ma'am. I actually looked into it. Yes, madam. I actually looked into it.
Should say, see once more. The pharynx is having a little bit less.
One serving size.
Gauri, you have to see that Cerelac-tin and see what is the calorie content.
1 level scoop is 8.3 gram, madam, in that tin.
1 level spoon. About 2 spoons will be coming. That is 16 grams, 16.5 grams. Okay.
Yes, madam.
16.5 grams will be the 100 grams it is yielding. That is 419 calories. So 16.5 grams. How much it will be? Please recheck it.
Okay, madam. Okay.
You should be very, because you people are not familiar with the artificial feeds, formula feeds and the complementary feeds. But whenever situation occurs, this type of children will be coming to you. Then you will be completely lost when some question is being asked. Okay.
Yes, ma'am.
In that sense, is it possible that the child is getting 620 calories?
No, madam. Then he would
have
get
to recheck.
80 kilocalorie only with that. 80 kilocalorie. Then the diet would be division by 1.
You see, check it in the this side. What is the calorie content of 100 grams of the
63.7 kilocalorie, madam. 63.7 kilocalorie.
Okay. Many of the commercial, at least 3 or 4. Okay. 2 baby powders, high calorie diet, normal for the appropriately, that is the weight, that is the full-term baby. These things may be needed when the mothers go abroad, etc. When conditions come, you will have to discuss according to that. This, yes. I think the 419 calories per 100 gram is the one. Some years back, I had just gone through the Cerelac. Oh, okay.
Calorie was deficit and protein was also deficient in the diet. And the diet does not include any poultry or meat items, and these diet were given in an over diluted form through bottle also. Nutrition history: the diet is deficient in calorie, vitamins, minerals, and has just adequate proteins, madam. 16.9, 17 is required as per ICMR recommendations. Home diet was not introduced, and the child is being supplemented with multivitamins and calcium from 8th month, and they were not giving vitamin D.
What would this be? This is a preterm and low birth weight baby. What will be your advice regarding the multivitamins, calcium, etc. for supplementation?
For a preterm baby, baby should be supplemented with multivitamins, including vitamin E, folic acid. Vitamin E, 15 units per day is needed.
Which is the vitamin we give much importance?
Vitamin D, madam. Vitamin D.
How much?
400 to 1000 units is needed for this child.
At least 800 units, because for the first 6 weeks, the child requires catch-up growth, isn't it?
Yes, madam.
Then
vitamin E is needed. Calcium and phosphorus in 2:1 ratio. 220 gram calcium and 100 gram phosphorus at least, madam.
Okay.
Coming to the immunization history, primary vaccination according to national immunization schedule is completed, but with delay. Child had taken the first vaccination from Sharjah, and then after from here only. From the second month, they took vaccination from Sharjah, and after that, they took vaccination from here after 5.5 months, 6.5 months.
What all vaccines were given to the child? You said it is completed.
Yes, madam. Child was given in the birth dose of BCG, OPV, and hepatitis B were given, and in the second month, from there, child was given hexavalent and OPV, and from here on, we were given child was given.
Hexavalent there contains what is the components of the hexavalent in Sharjah?
DPT was there.
Like ours here or any difference?
Uh,
You don't know, or did they show you the immunization card?
Immunization card was not shown, madam. It was
Okay, okay.
Then
for the time we will think that it will be containing the Hib as well as the injectable polio. Is it so?
Yes, madam. Then from the next month, from here he was taken as per our schedule. That is from DP Penta, OPV, Rota.
The first hexavalent was taken from Sharjah.
Yes, madam.
After coming here,
they took
apart
IPV,
from that,
IPV second dose extra was taken from outside. Second dose IPV was taken from outside, madam.
Okay.
And they complete, madam.
Any other vaccine given to the baby?
From our schedule, Penta was given, OPV was given, Rota was given, and PCV13 IP was given. And in the other schedule,
I am asking any other vaccine given?
No, madam. No.
Okay, come. The next vaccine is, you said it is completed. You said at the age of 8 months, that is, we don't consider the age of the baby for immunization. Isn't it?
Yes, madam.
No allowance. So was the baby given an important vaccine here because there were problems with the baby?
Yes, madam.
An important vaccine which is introduced in our immunization schedule now. Government hospitals, it is being given.
Currently PCV, madam. Latest.
Currently it is for some time.
PCV given to the child.
Given?
Yes, madam. Madam.
Okay. If PCV is being given, that is okay. What other vaccine should have been given to the child? Influenza virus vaccine. This is a preterm low birth weight baby is very risky to develop a fatal respiratory infection, and finally with that I think the baby had all these things, isn't it?
Yes, madam.
So when you say that primary vaccination was completed, don't say vaguely, including the pneumococcal conjugate vaccine, what is the valency available, I don't know. Then whether because after the age of 6 months, these infants should be given influenza virus vaccine. So these 3 vaccines, I am not very sure you know it. Whether inquired it. Okay.
Coming to the family history, he is the 3rd living child of a non-consanguineous marriage, and mother had 2 spontaneous abortions at 9 weeks and 10 weeks gestations, which was not actually evaluated, and there was no history of any recurrent abortions, neonatal deaths, or seizure disorder in the family. There was history of bronchial asthma in paternal grandmother, history of diabetes mellitus in maternal grandfather and grandmother. Socioeconomic history, family belongs to upper middle class as per modified Kupaswamy scheme. Coming to summary, 11-month-old boy with development delay and infantile spasm who was born preterm, IUGR, vaccinated for age, taking a deficient diet, currently admitted with decreased activity and feeding, with a regression of motor and personal social milestones. Possible differentials could be West syndrome or a neurometabolic disease, since the child had a worsening following a respiratory infection.
Okay, anybody having any difference of opinion? 11-month-old baby, developmental delay, infantile spasm. Here you cannot highlighted the socio-economic history of this lady.
Okay.
Somewhere you have written Kupaswamy scale. Just take that visual. Socio-economic history.
Yes, ma'am.
You have given the nothing social status. Family belongs to the upper middle class as per modified Kupaswamy scale. What are the components you take into consideration when to say that the family belongs to upper middle class?
Madam, father was doing a business and mother was a graduate there.
So you had to take scores What graduate?
Professional graduate. She did MSc nursing and the score and
MSc?
nursing.
Ah. Why
And
didn't you highlight these things? In spite of this, the lady never taken any care to prevent the next pregnancy after this baby was born. She was a nurse with a high educational status regarding child rearing, isn't it?
yes, madam.
Huh? Then, and you will be giving points scores to the education of the mother as well as the father.
Okay.
And she was never bothered to see the weight gain of the baby in spite of her good education regarding nursing. So when you say the upper ends are away, there are pitfalls. Why did the lady do like that? Okay, you have to highlight. Mother nursing, MSc nursing is not a small thing. You have to give credit to those types of education. In spite of that, what happened to this baby was continuing to be gross malnutrition. Okay.
Yes, madam.
The details you had to write, the mother nurse, you had to give. Father is doing what?
Father is running a business there, madam.
Education.
Education, he studied diploma, ITI kind of
That
business.
also, he is also reasonably having good education, isn't it?
Yes, madam.
Okay.
Madam, shall we go to the examination?
Ah.
General examination, child was drowsy and was responding to pain with a GCS of E1, V1 and M4. There was no pallor, icterus, cyanosis.
I told you there is another scoring system also.
4 score, madam.
Why didn't you bother to see the 4 score? What is the difference between GCS and 4 score?
Madam, in 4 score, verbal response is not included. However, the breathing pattern and brainstem responses are involved in 4
which way?
score.
Brainstem which way?
In brainstem, pupils and corneal reflexes, it is based on the 4 scores are there. When there is a pupil and corneal reflex is present, it is 4. And when one pupil is dilated and fixed,
anyway, please keep in mind there is a score, latest score, 4 score. Is it having any benefit as compared to GCS?
Yes, madam. Verbal in ventilated patients, verbal score instead of verbal score, we can use the 4 score since it is.
So if a short note is being asked on 4 score, you should be able to write it fully, completely, satisfactorily. Okay, continue.
There was no pallor, icterus, cyanosis, clubbing, lymphadenopathy, or edema. Heart rate was 90 beats per minute. Regular. Respiratory rate was 32 per minute.
A negative, somewhere you have to give some negative points. Everything you are just saying like that. See, in a child with malnutrition, you know that the child is having malnutrition. In the general examination, will you look for any negative or positive points?
Yes, madam. Child appeared wasted.
Over general examination, looking at the child, you look for any danger sign.
Dehydration.
Okay. But something just hits your eyes. Severe malnourished children, and when you see it, you consider that the prognosis is very bad.
Edema. Edema,
very good. That you have suggested. What else? Skin changes.
Skin changes, yes.
That you have to say there are no skin changes. What are here questions you can think? What is flaky pain rash, greasy pavement rash? Have you seen all those things?
Yes, madam.
So at least you have to say the skin changes of malnutrition are not there, which may predict a very bad prognosis, whatever you give to the baby to recover. Okay.
Okay. Then BP was 90/60 millimeter mercury, temperature was 98.6 Fahrenheit, and SpO2 was 99%. And in head to foot examination, head appeared small, normal in shape, hair was normal, AF was open.
Hair is normal.
Normal.
What will happen to the hair of children?
Sparse and lusterless hair can occur in malnutrition, madam.
That is not here.
It was. AF was open, 0.5 to 0.5 centimeter was normal in tension.
So at the 8 months, 0.5 to 0.5 centimeter anterior frontal layer is okay or not?
At 11 months, madam.
Anyway, it is not bad, but in this child, what do you expect?
Microcephaly is there, madam, so closure can occur.
Okay. And if the child is not at all given vitamin D, there can be a very wide fontanelle.
Yes, ma'am.
Okay.
PF is closed and eyes normal, no bitot spots or cataract. Nose normal. Ears was normally set. Mouth, she had 4 incisors. Tongue normal. Neck was normal. There was no redundant skin. Chest, there was no pectus carinatum or excavatum. There was no swelling of the costochondral junctions. There was no Harrison sulcus. Limbs appeared normal. Abdomen normal.
What do you mean by limbs appear normal?
Madam, there was no shortening of fingers, and in nail changes there was no pallor.
No, I just want to know what was the idea of saying limbs normal?
Madam,
what point you were highlighting?
Nail changes, madam, and pallor.
No, limbs normal means, is it that the child showing any rickety change or anything like that in your mind?
Madam, widening ഒന്നും ഉണ്ടായിരുന്നില്ല.
Do we expect widening of the long bones in this child?
Weight bearing ആയിട്ടില്ല, madam.
അങ്ങനാണെങ്കിൽ you cannot say widening or the epiphyseal ends getting widened because the baby has not started bearing weight. Okay. Which other thing you will expect in this child? If the baby is flaccid, what will be the posture? Limbs kept in which posture? And if the baby is spastic, what will be the posture?
Pick the frog appearance.
Huh?
Pick the frog.
I can't follow. Stiff babies, they will be the limbs will be kept very stiff. Okay.
In the spastic babies, it would be felt close to the body and in an extended posture. And in hypotonic babies, it would be in flexed posture.
Don't say limbs. There is no evidence of spasticity. Say like that.
Okay.
Spasticity, or how was it being kept? Normal.
Yes, madam.
Minimal flexion. Okay.
Abdomen appeared normal.
What do you want to convey by saying abdomen normal?
No distension.
Due to what? In this baby?
Sam was there, madam, for the child.
Huh? What was in your, I am not criticizing. What was in your mind?
Malnutrition was there for the child, madam. Port belly.
Malnutrition, what will happen?
Port belly.
Huh? Port belly due to what? See, you said there is a possibility that the child is having any storage disease. In that case, the hepatosplenomegaly will be there. If the baby is having any tuberculosis, here again there can be organomegaly and ascites. So there is no, you have to say there is no distension of the abdomen. Okay.
Yes,
don't say normal.
Okay. Male external genitalia and bilateral testes were descended. There was no neurocutaneous markers and there was no abnormal odor for the child.
Can you tell me some of the neurocutaneous markers which will be associated with any other MTPG here? All questions being directed to Gauri. Nobody is here.
Child is having infantile spasm, tuberous sclerosis. We should consider.
Welcome now. Come to the case.
Coming to anthropometry, weight is 6.3 kg, expected 8.1 kg, less than -3 standard deviation. Length of the child is 66 centimeter, expected 75 centimeter, which is less than -3 standard deviation. Head circumference 41 centimeter, expected is 46 centimeter, which is less than -3 standard deviation. Child is microcephaly. Mid upper arm circumference is 11.2 centimeter, which is less than -3 standard deviation, and the child is having severe acute malnutrition. Weight for length is 6.3 kilogram, expected 7.5 kilogram, less than -3 standard deviation. Overall, the child is having an acute on chronic malnutrition with microcephaly.
Okay.
Coming to system examination, nervous system examination, higher mental function, child was drowsy and was responding to pain. Cranial nerve 1 was not tested. Second, pupil sluggishly reacting to light. Fundus examination was normal. There was no evidence.
What do you expect to see? What was you were searching in the fundus?
Cherry red spots.
Huh.
Then there could be pigmentary changes or optic atrophy. In 3, 4, 6, pupil size are bilaterally equal and dorsal movement was preserved. In cranial nerve 5, corneal and conjunctival.
Here you had to give a comment.
Yes, madam. That is brainstem reflex. Brainstem is intact for this child since dorsal movement is preserved.
No, obviously, is there any squint? Did you
no,
say
no,
like that?
Okay, madam.
And the eye movements are all there because the child's eye movement can be elicited, isn't it?
Yeah, yes, madam. And cranial nerve 5, corneal and conjunctival reflex were present bilaterally. And cranial nerve 7, there was no.
5 stop. You go back to the 5. Yes, cranial nerve 5, you are concerned with the motor sensory part only. What is the important motor muscles that is being supplied? Anybody?
Masseter.
Any other?
Sucking.
What will happen to cranial nerve 5 palsy, complete palsy? What type of
jaw deviation? Jaw deviation. So there was no deviation of
madam. You directly went into the corneal conjunctival reflex. Say, I told you the other day, the sensory part you can very well examine by applying a cotton wisp of cotton at the nails, where which the child, if the baby is perceiving fine sensation, fine touch, the child would immediately show a facial response, even if the child is somewhat drowsy. So a child, because of the drowsy nature, maybe that the child did respond or did not respond, but you have not examined this earlier, isn't it? Then coming to the motor, you have to give a comment. Evidence of motor paralysis is not there. Reflex will come later. Okay.
In the cranial nerve 7, there was no facial deviation. Nasolabial fold were normal bilaterally, and there was no drooling of saliva, and closure of eyes complete. Cranial nerve 8 was not tested. And
why? At least ask the grandmother to call the baby. They said the child will be looking in the direction. Is it so? 8 months, is it okay that a baby will be looking in the moving the head in the direction of the sound that is coming? 8 months.
He should look down towards the side.
You have to give the correction for the prematurity.
Okay.
Even then the child should be responding to the sound.
Yes.
At least you can, okay, but there you have to give that the mother was asked to call or the grandma was asked to call the baby but not responding, maybe due to the drowsy nature. Okay. Not tested in the made an attempt.
Okay.
And you have to know the way you have to test by clinically the hearing of a child. Okay.
Cranial nerve 9 and 10, there was no nasal regurgitation of feeds. Gag reflex were present, but it's not exaggerated. In cranial nerve 11, head turning was there, but there was not much movement against resistance. There was no.
Was there any head lag on being picked up?
Child had a head lag on being picked up, madam. And cranial nerve 12, there was no asymmetry of tongue, there was no wasting or fasciculations. In motor system, bulk, there was no asymmetry. Child was wasted, but there was no asymmetry in both sides.
How do you make out the bulk?
Measuring.
You have to say the mid-arm circumference on both upper limbs and the mid-thigh and mid-calf circumference on lower limbs. That is the way you have to say. Very small baby, how can we say that there is no asymmetry? how much will you consider the difference between the two limbs? How much will you consider as significant?
2 centimeter.
That is for older people. 1 centimeter is okay for very young babies. Okay.
Okay. Tone, child had spasticity was there, and lower limb tones were more compared to the upper limb. And in angles, adductor angle was 88 degree, popliteal angle was 100 degree, dorsiflexion angle was 80, and scarf sign reaches till midline. Child had an overall increased tone in lower limbs more than upper limbs. Power, child was drowsy but was able to move his hands and legs against gravity. Slight movement was there, madam, but not against resistance. And in reflexes, superficial reflexes, conjunctival reflex present bilaterally, gag was present, there was no exaggerated gag reflex, abdominal reflex was present, cremastic
Is it okay that you show the abdominal reflex like this? There are 4 quadrants, no?
Yes, madam. Abdominal reflex.
Plus and plus.
Madam?
Abdomen, there are 4 quadrants
Yes,
that
madam.
we...
Yes, madam. Both upper and lower quadrants, both were present and symmetric.
You can very fine diagrammatically represent. Okay.
Okay, madam. Plantar were bilaterally extensive. Dependent reflexes, jaw jerk reflex actually couldn't elicit, I couldn't get, madam. Biceps jerk was present.
Normal or brisk?
Brisk. Biceps, triceps, supinative jerk. Knee jerk was also present, and brisk. Ankle jerk was also brisk.
Knee jerk 3 plus, is it brisk alone, or you say it as exaggerate?
Exaggerated reflex was there, madam. 4 plus actually.
Okay. Ankle.
Angle also, angle was also exaggerated. And in release reflexes, child had palmar grasp, tucking and rooting was present. And in,
why don't you look in the Moro reflex?
More.
See, this is a developmentally retarded child, and if there is cerebral cortical involvement, definitely the Moro reflex will be still preserved. That means a very bad prognosis.
Okay.
And the other one more thing is the presence of glabellar tap reflex.
Okay.
These 2 things we have to look. Okay.
Okay. Coming to the sensory system, child was minimally responding to crude touch and pain sensations. There was no abnormal movements or involuntary movements. Skull and spine appeared normal, and fundus appeared normal. There was no cherry red spots, pigmentary changes or atrophy. Dorsal movement were preserved. Coming to a system examination, respiratory system, respiratory rate was 32. There was normal vesicular breath sound. Air entry was bilaterally equal. There were no added sounds. Work of breathing was normal. And in a cardiovascular system, heart rate was 90 per minute. S1, S2 present. There was no murmur. Apex at 4 is lateral to midclavicular line. And in gastrointestinal system, abdomen was soft. There was no.
Okay, stop here. Lateral to midclavicular line means at what level?
1 centimeter lateral to midclavicular.
At the age of 8 months, do you expect that?
Midclavicular line.
Okay. Maximally 1 centimeter. Which that is metabolic disease, storage disease. So you have to specifically see for that. Okay.
GIT, abdomen was soft, there was no organomegaly, spleen was not palpable, liver span was 6 centimeter. Coming to the summary, 11-month-old baby boy who was vaccinated for age.
Who was not fully vaccinated. The details not known.
Okay.
That is important because the baby got respiratory infection once, isn't it?
Okay. Was vaccinated for age and having acute on chronic malnutrition with a global development delay, was born preterm at 36 weeks with a birth weight of 2.05 kg and previously treated with ACTH for infantile spasm, admitted in view of decreased activity and feeding. Examination revealed a drowsy child with preserved dorsal movements, microcephaly with hypertonia and exaggerated reflexes. Since the child showed a regression in the milestone, the possible diagnosis would be West syndrome or epileptic encephalopathy.
നമ്മൾ ഇത്രയും നേരം ന്യൂട്രീഷനൊക്കെ പറ്റി ഇരുന്നതിന്റെ മൈക്രോബയോളജിക്കും ഒരു വിലയുമില്ല.
Diagnosis global development delay with spastic quadriplegia, microcephaly, acute on chronic malnutrition, possible case of West syndrome.
See the spastic quadriplegia plus എന്തൊക്കെയുണ്ട്, ഏതൊക്കെ cranial nerve involvement ഉണ്ട്? One cranial nerve, one not cannot be tested. Two
normal ആയിരുന്നു madam.
നോർമൽ
അല്ല,
അത് അമ്മയുടെ മുഖത്ത് പോലും നോക്കുന്നില്ല.
ടൂല് ഇതുണ്ടായിരുന്നു, ടൂല് റെസ്പോണ്ടിങ് ഉണ്ടായിരുന്നില്ല.
വാട്ട് റെസ്പോണ്ടിങ്?
മദർ റിഗാർഡ് ഉണ്ടായിരുന്നില്ല മാഡം.
ഉണ്ടായിരുന്നോ?
ഇല്ല.
So what is the reason? Pupils are reacting to light, but the baby is not seeing anything. Where is the damage?
Would be cortical blindness.
So the child with cortical, do you think that vision is an important one for a person?
Yes, madam.
Okay. So there is a visual defect. Baby is blind. We don't think that because of the cortical damage, there will be improvement in the vision of the child. Okay.
Yes,
come to the diagnosis. Spastic quadriplegia, that is is it a progressive or static encephalopathy?
Progressive. But in this child, actually mother noticed the weakness by 6.5 months only. And she had not noticed the weakness, spasticity then. It was only on examination we found that the
mother, I don't think a mother who is never bothered about taking the weight of the small bodied baby, she is spasticity, she is being, do you think the mother will be look at that? My question, pertinent question is, child is having global developmental delay.
Yes, madam.
With that is in the form of spastic quadriplegia.
Yes, ma'am.
Okay. And the child is having an important special sense loss. Hearing you cannot properly because association of the special senses along with the motor defect, which is more important for the baby in the survival. Is it the motor defect that is important or the special senses?
For survival, motor.
Comparing this, suppose motor is more important. Is it so?
Yes, ma'am.
Our Nelson says motor defect is never a problem for the child. വളരെ important ആയിട്ടൊരു ലൈൻ ഇതിലുണ്ട്. Cerebral palsy ആണെന്ന് തോന്നുന്നു. Okay. So special senses, hearing and especially vision that is lost for a child, how can you make the child revive or improve the wisdom or intellect of the child? So vision loss, hearing also നോക്കിയില്ലല്ലോ, അത് ശരിക്കും നോക്കണം ഇങ്ങനെയൊക്കെ.
Hearing കുഞ്ഞ് നേരത്തെ ഇങ്ങനെ സൗണ്ട് കേട്ടാ നോക്കും എന്ന് പറഞ്ഞിരുന്നു മാഡം.
അല്ല, ഇപ്പൊ നമ്മള് നോക്കിയില്ലല്ലോ, അവര് പലതും ഒക്കെ പറയും. ഏതെങ്കിലും മെന്റലി റിട്ടാർഡഡ് ആയിട്ടുള്ള കുട്ടിയുടെ പാരന്റ് അടുത്ത് നമ്മൾ ചോദിക്കുന്നു, ബുദ്ധിയൊക്കെ എങ്ങനെ? ഭയങ്കര ബുദ്ധിയാ, എല്ലാം മനസ്സിൽ ഒതുക്കുക എന്ന് പറയും. അല്ലാതെ കേട്ടില്ല എന്നത് ഭയങ്കര പെയിൻഫുൾ ആണ്. പാരന്റ്സിന് കുട്ടിക്ക് ചിലതരം സെൻസ് ഒന്നും കിട്ടുന്നില്ല എന്നൊക്കെ പറയുന്ന പാരന്റ്സ് they know it, but they won't admit. It is our duty to elicit the particular response and see whether child is deaf also. Can deafness and visual loss accompany cerebral palsy?
Yes, madam.
What would have been the cause of visual loss for this child?
Maybe an undetected hypoglycemia since child was taken home the next day and sugars were not tested adequately.
Hypoglycemia specifically damaging the vision. You had to think some other damage, that is the damage would have happened in utero for this child.
If the child is already, child may be having placental insufficiency since.
Those things were not examined for the lady. Maybe a placental infarct or something, and that is damaging the cortex region. I don't know the MRI finding. Then child is having that is visual loss, blindness, plus partial hearing may be present. Microcephaly, okay. Acute on chronic malnutrition. So which will you seizures ille?
West syndrome.
West syndrome, then how will you explain the blindness, etc. for this child?
Symptomatic West would have perinatal insult, seizures.
Say types of West syndrome.
It could be idiopathic or secondary.
Then you had to say it can be a secondary
West syndrome.
That's specify and idiopathic, otherwise the child will be normal.
Yes, madam.
Okay. Then seizures. Syndrome controlled or not now?
It was controlled.
At the time of admission, was it controlled?
It was controlled.
Okay. Seizures were controlled, and there was some improvement also.
Yes, madam.
Then any other differential diagnosis? Did you go to the epilepsy part of Nelson? Anybody? There is another diagnosis that is being said, that is the developmental epilepsy. Developmental epileptic encephalopathy. The children who are having initially some developmental problem, along with that they develop epilepsy, that will be progressive in nature and it's a very grave one. And the medicines that give should be much more hiked up very much. Then I heard that the baby expired. What was the reason for death?
Child
later due to infection.
Child later developed respiratory problems and
later developed terminal cause of death എന്തായിരുന്നു? Respiratory aspiration വല്ലതുമായിരുന്നു?
Respiratory cause, madam.
Child develop another respiratory infection, or is it due to, what are the causes of respiratory insult in a child with cerebral palsy? It is at the age that is to be considered. At by the end of 1 year only we say that is evolving cerebral palsy. But what are the causes of respiratory insult in a child with spasticity?
Micro aspirations. Then in the secretions would be pooled due to decreased tone in the and since
that is due to this pseudobulbar palsy. Which one, in which type of palsy? Pseudobulbar palsy or bulbar palsy? The secretion will be more.
Pseudobulbar.
No. Bulbar palsy is the one you cannot see in bulbar palsy cases. When we were MD students, we used to see plenty of poliomyelitis. And what is the appearance of a bulbar palsy? Pseudobulbar, there is some control. Bulbar, it is total loss of control. So bulbar palsy or pseudobulbar palsy. Second, any other cause?
Micro aspirations.
Macro varathille, gastroesophageal reflux. Very important cause, because the esophagus will be stiff. So when the child is trying to swallow, a spastic child is trying to swallow, some will be regurgitating. Even from the stomach, it can regurgitate. So in the feeding of such children, you had to give somewhat thickened feeds, that is porridge like things. All right. What will you, how will you manage? We will think that for our satisfaction, the baby is still alive. Provided the baby was still alive, how will you manage the child?
Since the child presented in acute, I would like to manage the acute condition first. Since the child is initially drowsy, I would consider, since also the child is having malnutrition, I would consider child would be having sepsis and would have started on antibiotics after taking cultures, including CSF culture.
I can't follow. So which part of this diagnosis you take first? The West syndrome, you had a probably secondary West syndrome, or the other diagnosis can be, you go and read it, developmental epileptic encephalopathy.
Okay.
There is a condition like that.
Okay.
In the 4 parts of the diagnosis, that is the 4 or 5. Global developmental delay with spastic quadriplegia. Microcephaly is an accompaniment. And the special senses loss, vision perfect, completely lost, that is also you had to mention. Acute on chronic malnutrition and the seizures.
Okay.
Probably due to a secondary West syndrome or other diagnosis you can take. So which part you will take first?
Malnutrition part.
Was the seizure already controlled for this child?
It was initially controlled, madam, with anti-epileptics.
After admission to the hospital, in this time, was the seizure controlled or still it was recurring?
After admission, after around 2 days, a child had a recurrence of seizure.
Okay.
So,
so the malnutrition plus the seizures both require equal importance and attention.
Yes.
So who should be consulted? Seizure അത്രയും കോംപ്ലിക്കേറ്റഡ് ആയിരിക്കുമ്പോൾ ആരും ഇല്ലേ സ്പെഷ്യലിസ്റ്റ് ഒന്നും ഇല്ലേ
Neurology.
Definitely child will require a neurology consultation because it is going beyond our hands. And the seizures should be controlled because during seizures aspiration will occur and the child will die. And for the malnutrition, what will we advise?
Since child was
10 headlines.
Prevention or treatment of hypothermia, hypoglycemia infections. Then micronutrients. Then the other one is macro and micronutrients. Then dehydration correction, electrolytes.
Well, it is the discussion is beyond this class. So West syndrome, what is the ideal drug that is advised?
ACTH.
Plus?
ACTH plus ACTH or steroids along with the valparin.
Valparin is the drug of choice. Please go through the Nelson. They say the better drug is something else.
Vigabatrin tuberous.
Whenever it is written in your textbook, you have to follow that. And what do you think about the prognosis of this child? Prognosis you have seen. 4 or 5. Okay. Can you think of the inborn error of metabolism? Is it fitting into any of these things?
Sulfatase or arginine deficiency, but child was not having sulfatase. Sulfatase deficiency, arginine deficiency.
In the any disease you can trace. I could not trace, that's why. That is the blindness plus the quadriplegia, etc. Okay. So that is okay. Thank you for the very nice presentation. Thank you all. Will you leave?
Gauri, can you stop the sharing?
Okay, sir.
sharing stopping.
It is 8:30 past. Okay.
Okay. Gauri, it was.
താങ്ക്സ് പറയാനാ മാഡം.
ഞാൻ അങ്ങോട്ട് പറയാം താങ്ക്സ്. I am very thankful to Suresh and darling.
മാഡം ഭയങ്കര നല്ലതായിരുന്നു കേട്ടോ. ഞങ്ങൾക്ക് ഞങ്ങള് പണ്ട് ക്ലാസ്സിൽ പോലെ തോന്നുന്നുണ്ട്.
ഇത് എവിടുന്നാ സംസാരിക്കുന്നത് ഡാർലി മാഡം?
ഞാന് വീട്ടിലാ മാഡം.
ഓക്കെ.
ഞാൻ അവിടെ ഉണ്ടായിരുന്ന മാഡത്തിനടുത്ത് ഞാൻ വന്നേനെ. വരാൻ പറ്റാത്ത സാഹചര്യം ആയതുകൊണ്ട്
എന്താ
ഞാൻ കുട്ടിക്കില് വന്ന മാഡം.
അല്ല ഇപ്പൊ വേലുകാവിലല്ലേ?
കുട്ടിക്കല്ലേ?
കൂട്ടിക്കൽ.
അല്ല
ഉണ്ടോ വല്ല ഉരുളും എല്ലാം പൊട്ടിയിട്ടുണ്ടോ?
ഇല്ല മാഡം, വലിയ കുഴപ്പമില്ല അവിടെ.
ഇല്ല ഇല്ല. രണ്ടാമത്തെ ഒരു ചെറിയ സംഭവം അല്ലേ മാഡം?
അല്ല കഴിഞ്ഞ തവണ ഇടയ്ക്കൊന്ന് ഉരുൾപൊട്ടലൊക്കെ ഉണ്ടായതുകൊണ്ട്.
ഇല്ല മാഡം, ഇപ്രാവശ്യം എനിക്ക് പമ്പടയെടുത്ത് വെള്ളം കിട്ടിയത് തിങ്കളാഴ്ച രാവിലെ.
വെള്ളം
വെള്ളപ്പൊക്കം ഉണ്ടായി.
പമ്പാടി ഭയങ്കര വെള്ളപ്പൊക്കം.